Welcome back to another episode of Drug Talk. On this episode, we're going to be starting our cannabis fact playlist. Our first video is going to cover acute adverse effects and driving recommendations for cannabis. As always, I'm your host, Garrett Campbell, and I have recently completed my medical cannabis educator certification. So I'm going to use some of that knowledge to give you guys some facts about cannabis. So some common adverse effects with medical cannabis are impaired motor coordination and performance. Some people experience dizziness or drowsiness. Some experience fatigue. Gastrointestinal effects can occur, such as diarrhea, nausea, or dry mouth. Impaired short-term memory and information processing happens to some individuals, as well as altered judgment. Some people experience a decrease in attention, tachycardia, or a rapid heart rate. Orthostatic hypotension, so that's when your blood pressure decreases when you go from a seated or lying down to a standing position. Muscle relaxation can occur. Some people experience an increase in appetite. At high doses, individuals can experience paranoia or anxiety. Now, managing acute adverse effects of cannabis. Many adverse effects can be mitigated with low doses and slow titration. So it's always a good idea, similar to some medications we've discussed in the past, to start low and go slow. It's important in patients with underlying conditions and especially in elderly patients. If a patient experiences adverse effects, they should consider decreasing their dose. They can also adjust their administration technique. So you can decrease breath holding. You can use it orally rather than smoking it or using a vaporizer. Or you can increase the time between puffs. It's also important to consider trying a different strain of cannabis with different levels of THC or CBD. If you experience an unwanted euphoria or high, this is typically associated with high plasma levels through rapid inhalation of smoke or vapor. Euphoria is not required to experience medical benefits with cannabis. Consider a change in dose, changing the method of administration, or trying a different strain of cannabis. Operating a motor vehicle. Interestingly, in states with legalized cannabis, they've seen an 8 to 11% decrease in traffic fatalities. Now, this is thought to be due to a decrease in alcohol consumption, and it does not support cannabis being safe while driving. Patients are advised to avoid driving for at least 3 to 4 hours after smoking cannabis, 6 hours after ingesting cannabis, or 8 hours from either method if the patient feels a euphoria or a high after use. If you enjoyed these quick cannabis facts, subscribe now, and we'll be coming out with more facts at least weekly, where I'll just do similar presentations such as this, getting quick facts out to you. Take care. See you next time.